So propylene glycol vapor, animals will self-administer that.
Yeah, yeah. And then
Huh.
you add flavors on top of that, flavors that interact with, and we already know with menthol and nicotine and how that interaction happened and how that affects it. But then other flavorants, how they interact, both at the level of just the fact that it's a flavor and it's gonna have its effects on making it more likely that you use it, but also how it interacts with the pharmacology of nicotine. So I think there's multiple sort of layers in how that gets affected.
Hmm. Hmm. What are some of the active projects in the lab right now?
Yeah, so I think one of the things that we're doing. So one goal that we always have in the lab and this is probably why I can state Hill's causation points off the top of my head, is to try to get at causality, right? Take things from human genome-wide association studies or human imaging studies, reverse translate them into the animal models, and begin to get at that causal influence of whatever the factor is, right? Like if a study is showing that vaping changes brain function and connectivity in this way, in a human study. For example, they're doing the ABCD study, 12,000, 10,000 12-year-olds that they've recruited. They're scanning them every 2 years. And so there's data, real nice data coming out from it from a large data set. But again, there are compounds and it remains associational, right? So what we're doing is actually taking animal models where we're exposing animals to vaping or nicotine or cannabis or edibles for that matter. Or even have a model, an animal model right now of accidental cannibal, cannabis edible overdose.